be doing a cranial nerve assessment. So starting with the first one, which would be olfactory, which is a sensory nerve. I'll just be assessing smell. So close your eyes for me. Can you smell this?
Yes.
Okay, good. Second, I'll be assessing the optic nerve, which is also a sensory nerve, and that's basically visual acuity. So, how many fingers is it holding up?
1, 2, 5.
Good. Now, can you read that for me?
Christmas.
Good. Next, I will be assessing the ocular motor nerve, which is a sensory and a motor nerve. That's just basically pupil dilation or constriction. So I'll take a light and look straight for me. Good. Next is the trochlear nerve. That is a motor nerve, and that's just assessing the ability to look up. So look up for me. Good. Next is trigeminal. So that's also a sensory and a motor nerve, and that's just facial expressions. So close your eyes for me. Tell me what side I'm touching.
Left. Right.
Good. Then there's the abducens. That is also a motor nerve. Basically, that's just assessing their ability to move their eyes back and forth, side to side. So follow the pen light for me. Good. And then next is the facial nerve. That is sensory and motor, and that is assessing their ability to make facial expressions. So smile for me. Make an angry face. Smile again. Good. Next is the vestibular motor nerve. That's a sensory nerve, and that's just assessing hearing and balance. So close your eyes for me. Tell me what side you hear the snap.
Left. Left. Right.
Good. Next is the glossopharyngeal nerve. That's also sensory and motor. So basically that's just assessing your ability to swallow. So swallow for me. Good. Next is the vagus nerve. That's also sensory and motor. And that's what I would do there. That's assessing gag reflex. So I have a tongue depressor. I would put that toward the back of the tongue until you recite a gag reflex. Then there's the accessory nerve. That's a motor nerve. That's basically a shoulder shrug against resistance. So shrug for me. Don't let me break you. Good. Then last is the hypoglossal nerve. That's also sensory and motor. And basically that's just the ability to move the tongue in different directions. So stick your tongue out. Move it right to left, up to down. Good. And that's a cranial assessment.